Hey, it's Dr. Anthony Cave here to talk about this 100-plus-year-old observation that doctors are more likely to commit suicide than the average population. Also, really tragic, and it affects patients in more ways that they know. Patients who have doctors who are about to commit suicide are more likely to have a medication error, have a medical error. So that affects a lot of them. And I'm going to tell you just how much more likely they are to have a problem. But I first have to share the heartbreaking truth of what physician suicides look like, because the classic case is that a doctor sees their patients, finishes all their clinical work, and then goes home. And that's when it happens. And while suicides are the #2 cause of death in young people across the board, there is something about doctors that is a little bit different. And because it affects patients, you need to know about it. And there aren't a ton of studies that look at just how much higher the rates are, but it appears to be about 40% higher in men doctors, the rate of suicide compared to the average population, and in women, staggeringly high, 2.3x higher. And remember, I was telling you that if you're the patient of a doctor who is on the verge of suicide, who has depression, well, that's a 6x risk of having a medication error. So you're going to learn why that is, and importantly, how you can protect yourself. And there's going to be Q&A at the end. In case you guys don't know who I am, I'm Dr. Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And I want you to know that doctors are different in some ways in terms of their job, but they're not as different as you think. And we all share a lot of these, which is why you're going to learn a lot about the risks that all of us can have. And I already see the comments pouring in here, so I know that I'm not the first one to be talking about this. And if you know a health professional who has committed suicide and you're comfortable sharing, please let us know in the comments, because the more that people can share their stories, the greater we can raise awareness of this tragic, tragic occurrence that no one talks about in medicine, certainly not in my medical school or in my residency. And it's weird because doctors are well-resourced, to say the least, and they have access to medicine more than anyone else, right? We're around other doctors all day, but doctors are still so sick. What gives? Why is it that medical students first start off with less depression and a greater quality of life than their age-matched peers until they start medical school? And that's when something bizarre happens. And this is what I want you all to recall, because I want you all to know, because this is what I explain to my patients, because it is ubiquitous across humanity. There are two arrows. I don't think I've ever shared this on YouTube before, so I hope you guys like this. There's two arrows. One arrow in your life represents what you want to do. The other arrow represents, do you think you can do it? These arrows are a surrogate for our anxiety. So if I asked you to walk down the street and get me a sandwich from the deli, assuming you could walk and assuming you could order that sandwich, that probably would not give you anxiety, because you know you want to walk and you know you can get that sandwich. You know that's what you're supposed to do. They're parallel. But now if I asked you to come here to San Francisco and give a big, I don't know, start singing in the middle of Union Square outside my clinic, you might have a little bit of anxiety. So you want to go sing in front of 1,000+ people, but you might not think you can do it. I know it's a silly example, but look at how those two arrows now have a divergence. The greater the angle between those two arrows, the greater the anxiety. Has anyone ever felt this way before? The difference between what you want to do and do you think you can do it? This is where our uncertainties, fears, and doubts arise from, because the greater the angle, the more of them we have. And in doctors in particular, we have a tremendously small amount of control over our patients' lives. And I'm going to tell you, doctor to doctor or doctor to patient here, if you're listening, it can be tragic, and it puts a ton of horrible energy into our lives when tragic things happen to our patients that are beyond our control. So I already see people like Gabby knowing exactly what I'm talking about here. Heidi, good to see you, and I appreciate that you also hear me on this. And that angle of anxiety underpins so much of that lack of control that doctors have over their patients, and how much that can influence their lack of efficacy. Now, add that with things like retaliation. Did you know that as of a couple of years ago, the majority of states require doctors to report any mental illness rather than focusing on what they're doing to do right by their patients. So instead of looking at what they can do, they have to report their mental illness to the state boards. If that's not like raising concerns for being outed and shamed, aside from wherever you work, because remember, we work with other doctors, which means that if we see those doctors as a psychiatrist, like, are they going to tell our colleagues and our peers? There's a tremendous amount of concern here. In fact, you add that with the fact that doctors usually don't even have, not usually, a sizable minority don't even have a primary care doctor, partly because we can do it all ourselves, right? Not a healthy mindset, by the way, but that there's a great distrust of seeing our peers with really vulnerable and states of existence. It's hard when we're the doctor. I'm going to be fully transparent. When we're in the position of power, it's so easy to get used to it. Now, flipping that and now being a patient is very hard, speaking from personal experience. We have so little autonomy over our work, partly because those two angles that I described leave us powerless against some of the most challenging things that our patients face, but also because politics and regulation and bureaucracy has totally reduced our autonomy and the meaning that we get out of our work after we've put decades to train to become doctors. And that can contribute to burnout. And add that with defensive medicine, very litigious societies and patients with misinformed politicians laying down regulation, add substance abuse to that, because we know, especially with alcohol, that female physicians are more likely to abuse alcohol than the general population, with rigid education where there's no room to ask for help. And you wonder why doctors are lonely, why we have so much trouble reaching out for help. The loneliness is a big issue as well. And I know that patients also struggle with this because we're in a loneliness epidemic. I'm just going to give a quick shout out to Mel. I'm happy to see the thumbs up. And I am happy, Gabby, that, that the person you're referring to got help. And like Heidi says, politics and CEOs of hospitals make many people furious. The difference between anxiety and the constant adrenaline rush. That's a big one. Let's leave that for the end of the Q&A there. Great, great question. Deeper understanding. And I really like your username. So the loneliness that doctors experience is not all that different than the general population as you're already gathering. Because everything I'm sharing ain't unique to doctors, because I know my patients struggle with it as well. The loneliness that doctors experience comes from all sorts of things that we have to go through in medical school. Serious competition with peers, isolation. When I'm in the operating room for hours and hours and hours, I'm alone. I don't have anyone I can talk with. When I get time off of work, if it's after call, fortunately, I don't have to take call much anymore. But if you're free during a time that other people are not free, that's not valuable time to be free. Remember, time is a network good. So for those shift workers out there, you know what I'm talking about. You might have a Wednesday morning off, but if no one else has it off, it's not as valuable. And how about peers that understand what you're going through? It's hard to find people that know exactly what kinds of life and death situations doctors go through. And patients, we all have certain life experiences that are very difficult for others to empathize with. They all contribute to loneliness. And we know that can increase the risk of depression, especially when you add those life and death stressors to that depression. And that contributes to burnout. And that is the recipe for suicide, at least the suicidal ideation. And as you know, suicide typically has either substance use or mental illness as a strong contributor, at least in 90% of suicides. If you're learning something new, I want you to please share what you're learning with others, especially if you know someone who's struggling, either as a healthcare professional or another type of professional or not a professional. It doesn't matter, because what I'm sharing is not unique to doctors. You know that. And I know from the comments that you're all leaving that it's not just us at all. Please share it. Hit the like button to help me doing this more often. I'd really appreciate it. I do want to give a little shout out to one of my colleagues who is on a mission to help change this. And I support his work personally. I'm not being paid by him. Healthcare professionals have it hard to forge those relationships with others. And A Flutter Love is a dating app that actually is trying to help make it easier for healthcare professionals who are so marred and struggling with trying to forge those powerful connections in such a challenging and, quite frankly, toxic time to meet other people. I hate to say the dating apps have an interesting intention, they don't really work that well, especially for women who get harassed constantly when there are narcissistic, entitled individuals out there just making profiles for self-validation, when there's the trolls who just love the thrill of swiping in a particular direction. So hate, flood, or love does not go by that model. There have to be verified. You have to be a healthcare professional. If that's you, my colleague, Dr. Ray Conti, is actually the one building this from scratch with those intentions to emphasize in-person connection, not just virtual doom scrolling. And I support that. And if you're a healthcare professional, I recommend you take a look at his work because I think it is going to make it so much more meaningful for us to connect and to reduce that sense of loneliness. But moving on, the third idea that I want you to all recognize is this whole concept of heal thyself. We make a joke amongst doctors, doctor, heal thyself, because we do such a poor job of taking care of ourselves as physicians. And my patients who come to me in my ketamine center, who are doctors, surprise me time and time again, because they have forgotten these subliminal factors that have contributed to how they have sunken in to this depression. It's really curious that such educated people don't recognize their vulnerabilities, which patients share as much as we do. So if you're the patient, please remember, first off, before we even go down this list, that you need to advocate for yourself. If your doctor is depressed, I'm not saying doctors are bad people, I'm a doctor too, but that 6x rate of medication errors in that study is terrifying to me, and I want you to advocate. I want you to be comfortable and empowered to ask, hey, is that really right? I have a whole video coming up on how patients need to trust their instincts amongst doctors so that they can help hopefully prevent errors from happening. And given the rate of doctors out there who are depressed, who are not seeking help, which is tremendous because only about half of doctors with a mental illness seek help for it. And of those that commit suicide, only half ever actually sought help, which is terrifying to me. I don't want you as a patient to be in the crossfire. Doctors and patients alike have to reassess their angles of anxiety to help regain control. Please reflect on that. I think it's a powerful analogy. Many of my patients find it very helpful. Number two is the whole stigma around seeking help. I would rather take stigma on my ego and come out when I have an issue, which I've done on this channel before, than risk a patient's life because of my error, because of my mental health concerns. I hope other doctors do not succumb to their ego in such cases, but I know there's some out there that do have a big ego. And always ask yourself, if you're a fellow doctor, are patients worth it? Hopefully not. See here, the rigid environments with retaliation, I wish I had a solution other than advocating for the environment that you're in and not contributing to that rigid environment and those retaliatory comebacks that I've seen time and time again, especially in ivory tower medical circles. And number four, or part D, is to please establish care with a PCP. I don't care if you're a doctor or whoever you are. If you don't have someone that you can at least run your body by, you're just increasing your chances of things being missed. Whether it's cancer screening or mental health screening, it doesn't matter. You deserve to have that. And you probably have more power over your health than you've ever been told, which is why I hope that you can please take this to heart. Please advocate for your colleagues and loved ones. And let's jump into a couple of Q&As. Ooh, ketamine center. Oh, well, you can visit my website, claris-health.com. The link is always in the description below. Brenda, thank you so much for the kind words. Susie Style here is sharing that I had a doctor stream the F word and others had the same anger management. Exactly, Susie Style. This retaliatory, rigid environment. I'm in an operating room right now. Right? Want proof? We've got operating room lights right next to me. This is the real deal where I have seen so many adults in diapers screaming and yelling and throwing instruments around. If we don't stand up and advocate, and I have not been perfect. When I was younger, I would totally be the one who was like afraid to speak up. But I hope that you can speak up to change the environment, because why should the innocent patient suffer? I hope that you all learned something new to advocate for your health. And remember that you have more power over your health than you've ever been told.